To the Weekend Wake Up Show, March is Blood Clot Awareness Month. 900,000 Americans battle this each year. Joining us live now is Dr. Chris Pannucci with Plastic Surgery Northwest in Spokane. And Doctor, you've been on the forefront of patient safety research to decrease risks for post-op blood clots. Back in 2008, I understand the then Surgeon General declared blood clots as a public health crisis. What has changed from then to now? Dr. Pannucci.
Well, good morning, and thanks very much for having me. You're correct that in 2008, the Surgeon General, who was Stephen Galston at the time, identified blood clots in the legs, deep vein thrombosis, and pulmonary embolus, which are blood clots in the lungs, as a public health crisis. And at that point, set forward a multi-pronged approach of advocacy, research, and education to try to better understand this problem that affects almost 1 million people in the United States every single year.
What are the biggest risk factors? What do you want folks to know?
Sure. So risk factors for blood clots, some of the risk factors, things like advanced age, being hospitalized, cancer, or head-to-toe infections are common to many other medical conditions. But one unique thing about blood clots is that the risk factors are not always something that you can see. If you take a careful history and really drill down to it with patients, about 10% of people have a family history of blood clots in a first-degree relative. And that can actually be a marker of a genetic predisposition to clotting. That's important because family history of clots is an unrecognized risk factor many times. It can be a major driver of your own personal risk. And when incorporated into a patient-centric risk calculator, something called the Padua score for medical patients or the 2005 Caprini score for surgical patients, you can actually aggregate a patient's specific risk factors and assign them a percentage risk to better understand, are they a low-risk person, a high-risk person, and that helps you to design your prevention strategy.
So, Dr. Pannucci, what is the one thing you would want viewers at home to take away from this segment in terms of protecting themselves, advocating for themselves or a loved one? What would you like them to really know?
I think you said it right on, advocating for themselves. Certainly, Blood Clot Awareness Month is about education and advocacy. And for patients to be forthcoming with their providers or physicians about saying, can you help me to understand my risk for blood clots and how can we minimize it? Once the risk is understood and a thoughtful approach to that risk, there are risk factors that are potentially modifiable, things that can be removed or taken away. There are also prevention strategies that can be used, especially for hospitalized patients, things like squeezy boots on the legs, sequential compression devices, which can physically squeeze the blood up and out of the legs so that it doesn't get stuck and cause that risk for clots, as well low-dose blood thinners for hospitalized patients. Certain hospitalized patients can also be impactful. So to have that conversation around what is my risk for blood clots with your providers is the most important thing, in my opinion.
All right, Dr. Pannucci, thanks so much for sharing that very important information and just getting folks talking and spreading awareness.